Hi, I'm Dr. Daphne Moretta, and I'm the director of the Pulmonary Hypertension Center here at Loma Linda. Pulmonary hypertension is a serious condition that can affect many parts of your life, and we certainly understand that. This disease can affect your body, your feelings, and even your relationships with family and friends. At our center, we are here to give you the best care possible. One part of this care is palliative care. It helps you managing symptoms, improving how you feel day to day, and can even help you live longer. And it's a very important part of your treatment plan. I encourage you to watch this video to the end to learn how palliative care can make a big difference in your life. If you are referred to a palliative care team, I recommend meeting with them. They are here to support you and your family. Once again, thank you for letting us be part of your care, and God bless.
Hello, I'm Dr. Niranjan Jagannathan. I'm one of the physicians at our center who treats pulmonary hypertension. Studies have shown that including palliative care in pulmonary hypertension management results in overall better outcomes. Palliative care would complement the current treatment that you have been receiving or you're about to receive for your pulmonary hypertension. I strongly recommend you learn more about palliative care. Please ask your pulmonary hypertension team about it at your next visit. Thank you.
Hello, I'm Dr. Twinkle Chandak. I'm a pulmonary physician and I manage pulmonary hypertension. And this is my PH team, including providers, pharmacists, coordinators, nurse educators, and respiratory therapists. We're proud to serve you at Loma Linda University. It is well known that involvement in palliative care at any stage of the disease improves overall well-being of patients with pulmonary hypertension. Remember, while you receive palliative care, we will remain your primary physician managing your condition. I recommend you watch the following videos to learn more about palliative care and let us know if you have any questions. Thank you and God bless you.
Hello, I'm Gina Moore, and I'm the director of our palliative care program here at Loma Linda. And I'm really honored to work with Dr. Moretta and her team in the pulmonary hypertension clinic. So I wanted to take a couple of minutes just to talk about what palliative care is and how it might be able to help you. Really simply put, we want to help people live as well as possible for as long as possible. Now, you might think that's what all of us want to do. Sometimes in medicine, we focus on the disease instead of the person with that illness. And so palliative care is really very much patient-centered. So we're a medical specialty that was recognized in the early 2000s, where we focus really on folks who have a serious illness. Because we know with serious illnesses come lots of symptoms, and sometimes it's emotionally draining and it's hard on families, and people get really stressed out. So we are team-based, so it's not just physicians who take care of you, but we have chaplains and social workers who can help support you and your family. We want to provide whole person care. We know it's not just the physical symptoms that are worrisome, but sometimes social and emotional and spiritual distress can cause problems. So it's really about patient-centered care. So with pulmonary hypertension, we know that people can have symptoms from their illness, but they can also have symptoms from the treatments that we give folks. And while sometimes we try to help people live longer, we cause symptoms that make them not feel very well. So we want to help manage those. Some of you may have experienced some of these symptoms listed here. Shortness of breath and chest pain and fatigue are very common, but maybe you're lucky and you haven't experienced many of them. Whatever your situation is, we want to help you feel as good as possible. We might use medications to manage these symptoms, but sometimes you just need someone to listen, and we are happy to do that as well. Another way of looking at palliative care is that instead of thinking that you have to choose between your treatments for your pulmonary hypertension or palliative care, actually, you get both at the same time. So both doors lead to the same place. So there was an important palliative care study a few years ago that showed that palliative care can help people improve their symptoms, but not only that, it can actually help people live longer. And if you think about it, if we can help you feel better, sometimes actually people do better. So that's what our goal is. So we really want to focus on helping people live as well as possible for as long as possible, help you in feeling better, in having control. Sometimes you'll have to make decisions about what treatments you may or may not want to have, and we help you think through those things. And we're really there to support families as well. So I hope that this has been helpful, and we hope to see you in the palliative care clinic soon and help you feel better. Thank you so much.